Good afternoon, everybody. Welcome to Facebook Live. Sorry for the delay today. We had a lot of late breaking news and a lot of information to cover to ensure that we get the proper information to you in a concise manner as we possibly can. Obviously, a lot of developments over the past few days in and around the community, and there was a task force meeting held today to discuss in great detail what the next steps will be for our community. And as you know, last week we put out the alert levels that was put out to the community with the green, yellow, orange, and red. Obviously, escalating as the colors change. We initially started off in the yellow zone, which was a caution to be careful. And then as things evolve, they move into the orange, which is a higher risk of transmission. So I'm here today to officially inform you that Kahnawà has moved into the orange, which corresponds to a higher risk of the possibility of transmission of COVID-19. And with that, as you see on the graphic, that there are many possibilities that could happen within the orange zone. And at the task force meeting today, we did look at many elements, and we did take some initial steps to address the current situation. Keep in mind, these are the first steps within the orange, and things may be phased in over a period of days, and depending on how long this will last. So we are officially in the orange. So what that means is a few things. Effective immediately, gatherings. Private gatherings are now limited to a maximum of 6 people. And public gatherings are limited to a maximum of 25 people. That is effective immediately. The reason for minimizing this is because through the contact tracing throughout the whole province has shown the primary source of transmission was with public and private gatherings, where there is very little controls. So that is effective immediately. 6 people in a private gathering, which basically is within your home, and 25 people in a public outdoor space or a public indoor space, for various gatherings. The businesses were assessed, and they will maintain the status quo for the immediate future. This is always subject to change as things are evolving very quickly around us. They operate under a different directive, and at this point in time, because they are a controlled environment, they do have safety mechanisms in place. They do have regular inspections that for the time being, they will operate at the same level as they are now with enhanced inspections. And as I mentioned, this is something that will be assessed on a day-to-day basis. Areas of sports and leisure will also first and foremost, remind the people who are responsible, mainly the coaches of various organized sports, the parents, and even the players. There are safety plans that were presented to the task force, safety plans that were approved, and it is each and everybody's responsibility to make sure that those plans are followed. They will also be subject to the maximum of 25 people gathering for these events to minimize the possibility of spread of the virus. So what we're trying to do here is ensure that we have some activities that at this point in time can still operate under an adapted approach, modified approach, provided that we limit the gatherings, and provided that the people who are responsible for that particular activity follow the directives, follow the plan in which they put forth, because if not, then obviously it puts everybody else at a higher risk. So we're looking towards the empowerment of those people who are responsible. Again, this is a preliminary initial response under the orange, but as the orange evolves and the situation around us evolves, obviously certain measures may change. Regarding travel, it is highly recommended at this point in time that you do not travel to anywhere that has a higher level than we have here in the community which is orange. We just learned minutes ago that as of Wednesday, Montreal area will be deemed to be a red zone, which will mean much more strict measures for the island of Montreal. So we will be watching that very closely, as Montreal is our neighbor, so we will have to assess things on a day-to-day basis as we move forward. So again, it's highly recommended that you do not travel to anywhere that is a red zone. Further to that, we're also advising the community to please stay local as much as possible. As you recall, going back earlier on in the pandemic, we asked people to stay local, stay in Kahnawà as much as possible. If you have to go out of the community, you go out for specific purposes and return back home as quickly as possible. So along those same lines, we're asking people to please stay local as much as possible. Any unnecessary outings are certainly discouraged. We spoke briefly about the schools. The schools are still operating. They are in the process of moving their plan forward to do online learning if that is required. They are doing a full mobilization in that area. The teachers and the administrators have met today. They still feel that the situation in the schools remains stable, remains safe. There are some areas that will require some improvement, but overall they feel that it is safe, and they are addressing any concerns that may arise. But from a task force perspective, we're certainly looking forward to them presenting that clear plan moving forward in the event that we have to move to online learning only. So this is the first phase of the orange. I could say things are going to be literally assessed day to day and maybe even sometimes hour to hour. So we will keep people up to date as we possibly can with Facebook Live, through press releases and such, because there are more details with each one of these measures that will be released on the Facebook page through various communiques and such that will specify a little more detail moving forward. We didn't want to put too much information out today on the details, but like I said, it will be forthcoming. And I'm sure, as we all know by now, there have been some positive cases in the community. And this is certainly, I'm sure, and we know for sure, matter of fact, that this has shaken the community. It had made people become aware of the fact that, the virus is certainly still around us. And now, unfortunately, there are some positive cases in the community. But we should use this as an opportunity for us to look at our own personal behavior, how we're conducting ourselves, how compliant we are with the current measures in place, how we're respecting the distancing, the hygiene, and the masking, to ensure that we do our part as individuals to minimize the spread of the virus. So it's certainly not time to point fingers or blame anybody, because it could happen to anybody. Even people being completely safe have the opportunity to contract the virus. Nobody's immune to it, but you can take measures to ensure that you minimize the spread and you minimize your chances of being impacted or contract the virus. So use this opportunity to look at yourself and see how you can make sure that you do your part. Much more information to come. We will have a Facebook Live tomorrow, as well as tomorrow Lisa Westaway and I will be on K103 in the morning to discuss in more detail some of these the measures, maybe give a little more explanation exactly what they mean, and more information will be posted throughout the evening today. But to speak more about the medical side, about contact tracing and such, we today is Dr. Gautier, our medical advisor to the task force, and she is here to give you so much more information on that. So with that, Kahnawake, I'll see you tomorrow, and take care. Be safe.
Hi, Kahnawake. You can see that this was just an impromptu Dr. Gautier visit, because I'm not wearing any makeup. You can see the bags under my eyes. And the reason for that, oh yeah, you have to go in a little closer, I think, to really see. Like, there's really darkness going underneath there. And the reason for that is because the public health team, our local team, Don Montour, Lisa Westaway, and I have been working all weekend on something that I think a lot of you know because the community is small and people talk. So there are 3 cases in Kahnawà. 4 cases I've just been updated because we're still waiting on the results of two patients. So we have 4 cases in Kahnawà that all likely stem through a hockey team. The Kahnawà local hockey team. It's not every hockey team, it is one particular hockey team. And why I'm making a point of this is that I get that everyone is worried. I know that you're all worried because the phone has been ringing off the hook at the task force, at KMHC, at the testing center, because you're all worried about what does that mean for exposure for you. So that's why I'm here today to talk a little bit about what we do when we have a case and what puts you at risk. And I know you know all of this information, but often when something happens, you sort of forget what everything you've learned in the past. But we've got this. We were clear of COVID from May until now. We've got this, okay? You know what you need to do. And what you need to do is to stay within your family bubble. Everyone else, you're distancing 2 meters, you're wearing a mask, you're washing your hands. Have I always told you that the thing when you're worried or when you fear, you have to think about education? And so I have some good friends in BC who are excellent at communicating and, like our team here in Kahnawà, of creating easy to understand communications tools. So I want to bring up one on case contact tracing. Okay, so this is from British Columbia, their BC CDC. And so we're looking at here is the green person in the middle that says COVID-19 positive. They've just gotten a diagnosis that they're COVID-19 positive. We know they got the diagnosis because the blue public health nurse, which could be a male or a female nurse, is calling the COVID-19 patient and saying, you have been just diagnosed with COVID-19. And at that first phone call, there's 1, informing them, explaining what happens, and then 2, making sure that they don't have symptoms, and if they have symptoms, what they are. 3, making sure that they isolate and they understand what self-isolation means. That doesn't mean going on a trip. That doesn't mean going in your car and going to McDonald's. It means staying in your house, ideally within 1 room, away from the other members of your household, ideally using your own bathroom if possible, having another member of the household bring and leave food for you at that place that you're sitting. The 4th thing that they're actually looking at is they ask, once they've made sure the patient's stable and okay, we go through what kinds of contacts have they had. So you have here in the bubbles, we have what are the home contacts, what are the work contacts, and what are the community contacts. So we're going to scroll down a little bit to see. Now you can see that only contacts who may have been exposed to the positive person's respiratory droplets, and that means through sneezing or speaking or coughing, those are the people that need to be identified. So it's not just a matter you've been in the same store or you've been, you went to the gym that person used after the fact. We're talking about you have to be within 2 meters and get those respiratory droplets on you. Okay? And then the question is are you wearing a mask, and is the person wearing a mask? And that's why we go through the whole thing that if you have to be less than 2 meters apart, which you really shouldn't be, wear a mask. If you keep going, scrolling down, we have now public health now gets in touch with all of the close contacts. So those are the people who have been less than 2 meters away for more than 15 minutes and ask them about the symptoms of COVID-19. So they ask them about their symptoms, find out what they're doing. Now, all the people in this little diagram that are coughing, the little white things coming out of the mouth, that's indicative cough in this picture. The people with it looks like they have a red afro, that's actually, they have a fever. And the red thing out of their mouth is not a cigarette, that's a thermometer, just to let you know. So that person with the fever and the thermometer in the mouth, that person, as well as the person that has the coughing and the little kid with the coughing, those people would be asked to be tested, okay? Now, contacts with symptoms are sent for testing, so scroll down please a little bit. And so we have the contacts for test that had symptoms will be tested. Also, close contacts that local health determines that you need to be tested will be tested. For those 4 cases, if you haven't been contacted yet, it's because you are not deemed to be a close contact. And it's only close contacts that have been called to get tested and to isolate. Okay? You can see also on here that contacts with no symptoms are asked to self-isolate for 14 days since their last contact with the positive person and monitor for symptoms. So I'm going to be really specific on this. So if someone was exposed and the last time that they saw each other was on September 20th, the isolation would start 14 days starting September 20th. Okay? Let's go down a little bit. We have that COVID positive case, then a new case that comes up from the contact tracing. Then again, local public health gets involved and we find out the more contacts through the community, through work, and through home. And when a contact tests positive, we continue this cycle. We are on top of this. That's why on a Sunday afternoon, you might watch, I don't even know what sport is playing at the moment. I don't know. Whatever sport happens to be playing, you see, I don't know because I don't watch any television. Apparently football is playing. People are pantomiming football. So while other people are watching football, I am calling all the contacts. Don Montour is calling the contacts. Juanita Belanger, Lisa Westaway, we're all doing this to protect the community. What is your role in this? Your role is following the things. It's not the time to have family gatherings. It's not the time to go and hang out with people and give hugs to people unless they live within your family unit. That's who you're going to be giving all your hugs and all of your loves. Everything else has to be done through virtual. All right, can we switch to the PowerPoint, please? So this one is actually made by me, and it's on our Kahnawake COVID-19 Task Force website. It has been there for months and months and months. Look at the bottom. It says hygiene, distance, mask. That's the rule that we all need to be following. Also, this little start point. Contact is less than 2 meter distance, greater than 10 minutes in the 48 hours before they develop symptoms until the end of their isolation. That's what we're talking about is close contact. So we go through this. The top line is I have been. So if you've been in contact with someone that has been diagnosed with COVID-19 and you have symptoms, you must self-isolate and get tested yourself. And then you are fine and allowed to not be in isolation when public health tells you. If you've been in contact and you have no symptoms, but public health deems that you're a close contact because, again, you've been less than 2 meters, greater than 10 minutes, without wearing PPE, so not wearing masks, then you would self-isolate for 14 days and you monitor for symptoms. If you get symptoms, you would get tested. Public health in some situations will ask you to be tested. If you've been tested for COVID-19, no matter if you have symptoms or not, you self-isolate. You stay in your house. The only place you can go is from the test center back home. You can be in your house, you can be on your property, but that's it. You should not be around the other members of your household that have not been tested because they have not been deemed to be a close contact or because they are they have no symptoms and they're not related to the contact. If you've been to a place where someone has had COVID-19 and you weren't even around the person that actually has COVID-19, you don't have any symptoms, you can stay home and monitor for symptoms, but you don't have to stay in your house. You don't have to self-isolate. If you get symptoms, then you would self-isolate and get tested. The next is, I think I may have been in contact with a COVID-19 case and you have symptoms. Well, then you go back to, you have symptoms, you self-isolate and get tested. I think I may have been in contact, I heard through the grapevine that Joe X was at a party and I was at that party, and then I heard a month later he got infected with COVID-19. If you don't have symptoms, you do not need to self-isolate and you do not need to call the task force, you do not need to do anything except for the distance, hygiene, and masking. If you've been to the US, no matter if you have symptoms or not, you must go under a 14-day self-isolation quarantine by the Quarantine Act. Okay, so that's where I've done with this. So we can bring it back to me. Okay, thank you. So we have this. You know what to do. I know it's scary. We haven't had a case since May, and then suddenly we have a case. They're pointing at me, so I'm not really sure what they're doing. This is always the problem with these Facebook Lives. If you have been deemed to be a close contact, you have been called already by public health, by our local public health team. That's what you need to do. You do not need to be staying at home and isolating unless you've been contacted by the local public health team and told to do so, or you have symptoms de novo outside of this contact. If you have symptoms, you stay home, you isolate, you call the COVID-19 testing center to get tested. Kahnawake, we have this. We're going to be able to go through this. But in order to go through this, we all have to take personal responsibility. We all have to stay distancing. We all have to mask. We all have to do hand hygiene. You got this. Take care.